Good morning. Today we will present our new robotic soft tissue protecting cutter for making the bone resections in total knee arthroplasty. There are no conflicts of interest related to this work. The three currently used cutting tools to perform the bone resections in TKA are the oscillating saw, a cylindrical mill and a spherical mill. As generally known, it is very difficult to retract the soft tissue at the posterior side while making the proximal tibial resection. Let's zoom into the sagittal cross-section at this location. If we use an oscillating saw, it could theoretically be possible to cut exactly till the border of the bone without penetrating the soft tissue, but because of the rectangular shape of the blade and the curvature of the bone in the posterior zone, this is quite impossible to achieve. The cylindrical mill can be used in two orientations. In the first orientation, cutting till the edge could result in interference with the soft tissue. In the second orientation, there are two options. It is possible to avoid interference with the soft tissue, but then it's impossible to make a complete bone cut. If you make a complete bone cut, this can unfortunately result in interference between the mill and the soft tissue. When using a spherical mill, the same issue as with a cylindrical mill in the second orientation is present. We can conclude that performing complete bone cuts with zero risk for soft tissue damage is hardly impossible with these tools. Our solution is a robotically controlled soft tissue protecting cutter consisting of a long mill driven by a high-speed spindle supported by a protector at the end. The second picture illustrates the application on a proximal tibial cut. The resection is performed by milling a slot while the support structure follows behind. The cross-section of the proximal tibial cut shows how the protector tip follows the circumference of the bone while the protector tip shields the soft tissue from the mill. For the proximal tibial resection, first the incision boundaries are registered and a cutting path is generated. After the approach of the tool, the resection starts and the protector tip follows the contour of the bone till the resection is finished. To enable the protector tip to actively follow the edge or contour of the bone, a repetitive probing motion of the protector tip is made. Each probing motion, a new point on the physical bone was detected by the force feedback on the protector tip. The measured physical location was used to update the prediction of the virtual bone location. This video shows a demonstration on a proximal tibia without soft tissue. The movement of the probing motion is enlarged for demonstration purposes. As you can see in the simulation in parallel, the touch points are used to update the virtual bone location, enabling the accurate prediction of the actual bone location and thereby allowing the protector tip to follow the edge of the bone more closely. With this approach, initial registration errors are compensated while the soft tissue is shielded from the mill at any time. This video shows the execution of the proximal tibial cut on an intact fresh frozen cadaver knee. The approach has been tested on a small series of which I will present the results. After finishing the bone cuts, we evaluated the soft tissue damage with the MASTI score as proposed in the work of Kayani. Based on this evaluation protocol, we obtained an excellent score demonstrating low soft tissue damage. Furthermore, we registered the resected surface to evaluate the flatness of the cut. Both the standard deviation of the roughness profile as the interplanar flatness were reduced significantly compared to the oscillating saw by using the high-speed milling tool. By using the active bone contour following approach, we managed to predict the physical location of the bone contour 3 times more accurately compared to using the initial surface-based registration. Finally, by robotically controlling the cutting tool, we managed to obtain a more consistent cutting time in comparison to the oscillating saw without increasing the average cutting time. To conclude, we demonstrated a promising new approach for making the bone cuts in total knee arthroplasty, which allows to actively and accurately follow the bone contour. Therefore, this approach has the potential to work imageless. By using a mill protector, we minimized soft tissue damage. The high-speed milling process results in an excellent flatness of the resection, and the approach is as fast as the oscillating saw. Thank you for having joined this presentation.